How do they offer zero-cost monthly Medicare Advantage plans? I'll tell you. Hi, I'm Kevin Knaus with InsureMeKevin.com, and many years ago when I got involved with health insurance and marketing Medicare Advantage plans, I was always perplexed how they could offer these really good plans at very low monthly rates when health insurance for people that were over 60 was, like $1,000 a month. So I started doing some investigating, and when it comes to the Centers for Medicare and Medicaid, they have some really smart people. Now, Medicare, they have all this data that comes in from across the country, from all the different people, all the different procedures, and of course they break it down by state and county to see what it costs to insure a Medicare beneficiary. And now this statistical number crunching, the guy that you went to high school with that was a math whiz, well, he's an actuarial person now, and he works and they work for Medicare, crunching all these numbers because it is very, very complicated. So they come up with a number that they call a capitation rate, and that is the monthly amount that Medicare will pay to a Medicare Advantage plan in a particular county for a plan. Now, it's the Medicare Advantage plan to the plan sponsor to develop how they're going to structure the plan. And it has to be within certain guidelines for Medicare. But Medicare is going to pay them a certain amount. In California, most of the rates, monthly rates, are over $1,000. So if you enroll in a Medicare Advantage plan, know that in most instances, Medicare will be paying that plan at least probably $1,000 per month on your behalf and everyone else enrolled in the plan. And that is to cover the expenses. Medicare is transferring the risk. Now, when you're in a Medicare Advantage plan, you still have original Medicare, but that Medicare Advantage plan is the company that handles all the claims, and it has a maximum out-of-pocket amount on it, which original Medicare doesn't. So these capitation rates that you can find on the Medicare website, now this is just for parts A and B. Many Medicare Advantage plans have the prescription drug portion of it, the Part D, embedded into it, and when they do, there's an additional payment from Medicare because these are two separate plans. So this capitation amount that we're talking about today is just for the health and medical portion. And you can see the different columns there for these counties in California. And the bonus amount, that's for quality. If a plan has good star ratings, quality ratings, they may get a bonus. There's a lot of things that go into that. The very far right column, ESRD, that's for end-stage renal disease. So for someone who has kidney failure, then that Medicare Advantage plan is looking at receiving at about $9,200 per month for that individual because there's dialysis that goes onto it. And then the zero bonus, that's kind of like your baseline benchmark. That's going to be the very bare minimum. If the plan sponsor's plan is accepted, that's what they will be receiving. There's three different images. This one's Alameda through Madera, and then another one from Marin through San Mateo. You can see all of the rates. And California is expensive, but looking at other states, they're up there as well. And then there is also Santa Barbara through Yuba. But I was kind of looking at, I was interested in what is the highest and the lowest. Interestingly enough, the two counties, the county with the smallest monthly capitation rate is Imperial County at $939.40. And right next to it, kind of geographically as well, is Inyo County with a monthly capitation rate baseline of $1,301.36. Now, this doesn't mean that the people in Inyo County are sicker or have to go to the hospital more than the people in Imperial. Medicare has different reimbursement rates in different areas of the country because hospital systems and cost of living. Again, it's really, really complicated how they come about this. But there may be some other factors, but that's going to be the baseline rate to insure someone for parts A and B. But how does that compare to overall health insurance? So now health insurance, and I pulled these numbers through Covered California, individual and family plans, that only goes up to age 64 because when you're age 65, you should be Medicare eligible. And plus the way the law reads is that's the maximum. You could be 70 years old and still qualify for a private health insurance plan, and it would still be the rates of a 64-year-old. So Imperial County for 2022, the lowest cost bronze plan, kind of catastrophic, is $824. And in Inyo County, the lowest cost bronze plan is $1,099. So right there, we can see that even the private health insurance market has rated Inyo as a little bit more expensive than Imperial. And again, that has to do with doctors, hospitals, and many other different things. Now, the silver plan, lowest cost silver plan, $849 in Imperial and $1,407 in Inyo. Now, the silver plans have drug coverage, whereas the bronze doesn't. Both of the bronze and the silver, they both have $8,200 maximum out of pocket. Original Medicare doesn't have a maximum out of pocket amount. And that's one of the downsides to Original Medicare and one of the upsides for the Medicare Advantage plans, because many of them will have a maximum out of pocket of anywhere from $3,000 to $6,000. Once you hit that, all of your medical expenses will be covered at 100%. Part D drugs, that's separate plan, and that has different plan rules next to it. So then let's look at the capitation rates for Imperial and Inyo, just parts A and B. Of course, we mentioned Imperial $939 and $1,301 for Inyo, but we also have to remember when we're thinking of income streams into the Medicare system that people are making a Part B premium of $148.50. So that goes into the mix. And what isn't readily seen is that Part A, the hospital insurance of Medicare, if you work 40 quarters or 10 years and pay the Medicare tax, that is premium free. If you do not have those work credits, for 2021, you need to pay $471 per month for Part A hospitalization. And Part A, if you're hospitalized, I think it's about a $1,500 deductible for a 60-day benefit period. And then there's co-insurance after day 60 if you're in the hospital that long. Part B, as you know, there's a very small deductible of about $203. Then you go into 20% co-insurance. But there's no cap on that. So when we look at adding kind of those costs together, and I'm not saying that that's it's not, we're not comparing apples and oranges and apples here. That's the problem. Things are a little bit different. But we can kind of get a sense of how much it costs to insure somebody, a Medicare beneficiary. And you can see that in the private area is very similar to the Medicare capitation rates. So it's just not a big giveaway to the Medicare Advantage plans. I'm not saying that the people in the Medicare Advantage plan sponsors, they're as smart or smarter than the people at Medicare. They're playing all the different angles. They're adding things in there that are kind of head scratchers to me, and still offering very low monthly premiums to those people who enroll into it. But know that if you are in California and you enroll in a Medicare Advantage plan, Medicare will send probably on average about $1,100 per month to that Medicare Advantage plan that you enrolled in. So It's not free, it's not cheap, but it seems to be in line with a lot of other things when we look at actuarial values and the cost to insure someone for health care services. So I've posted all of these on this particular blog post on my website. I try and update that every couple years with the latest capitation rates. If you have any questions, you can leave comments down below or give me a call. So for InsureMeKevin.com, I am Kevin Knaus.